Hi, my name is Laurie Stevens, and I am going to talk to you about giving the gift of life through kidney donation. Most everyone has heard of organ donation after death. However, I want to discuss with you organ donation prior to death, more specifically kidney donation. Before we do, I want to help you understand the process a patient must go through in order to be considered going on the kidney transplant list. Each patient that's being considered for transplant must go through a thorough evaluation. This evaluation is to determine whether or not they are a good candidate. They must go through, routine tests like labs, chest x-ray, ultrasound, but cardiac is very important. They must have an extensive cardiac evaluation to determine that they will make it through surgery. They also have to have ultrasound of their kidneys to ensure that there is no active cancer. They have to have all of their age-appropriate screenings like mammograms and things like that. This process is very lengthy, and you have to remember that these patients are on dialysis for 4 hours or more, up to 3 days a week in order to stay alive. So that leaves very little time for them to have other appointments. Once all the testing is done, then they are presented through a transplant coordinator to go to a selection committee. This selection committee is made up of doctors, surgeons, dietitians, social workers, nurses, and collectively they take all the results from the previous testing to determine whether or not they are a good candidate. If they are determined that they are a good candidate, they are placed on the United Network of Sharing Organs. This is called UNOS. It's a database along with 100 other 1,000 patients that are listed in the United States. There are 10,000 patients, over 10,000 patients that are listed on this database in the state of Texas. 4,000 of those live here in South Texas. That's a staggering number. The average wait time for a kidney is 5 to 7 years. That's an important number that we'll talk about later. Since 2005, donation rate has stayed very steady. About 20,000 kidneys are donated each year. But remember, there's 100,000 patients waiting on the list. 13 patients die each day waiting for that life-sustaining kidney transplant. That's why it's important to dispel any myths or mysteries behind living donation. Dialysis and medical treatment are the only alternatives to transplant. However, the average life expectancy is only 3 to 5 years on dialysis. Now remember, we said that the average wait time is 5 to 7 years. The average length of life expectancy on dialysis is 3 to 5 years. However, dialysis does keep you alive, but they're trying to accomplish something in 4 hours, 3 days a week, that normal kidney function does 24 hours a day, 7 days a week. Transplant replaces the failed kidney. It lets you live. It helps you, it gets you free of the constraints of dialysis. You're able to engage in sports, hobbies, life with a relatively unrestricted diet. There are 2 types of kidney transplant. A good candidate that is placed on the UNOS database has to wait his or her time. But living donation, there is no waiting once a suitable donor is approved for donation. Potential donors will undergo a thorough medical evaluation, very similar to any recipient's evaluation. It includes screening for kidney disease, infectious disease, any other conditions that may lead to kidney failure later in life, like hypertension and diabetes. Testing may include blood work, chest x-ray, CT of your kidneys, an EKG, and other tests to determine your risks for being a potential donor. All these are necessary because the goal is to reduce any risk of the donor developing kidney disease in the future. We don't want them to be in the same place that our recipient is at this moment. A potential donor will see a social worker. The social worker will evaluate to ensure that they're pursuing donation on their own free will, no coercion. The social worker will assess decision-making capacity and screen for any mental health issues. Once all the testing is done, a potential donor has been approved with a transplant center. The surgery will be scheduled at the convenience of the donor. The most common way to donate is through a procedure, laparoscopic procedure. It is minimally invasive, and it requires an incision usually through the belly button where instruments are inserted and the kidney is removed. Living kidney donors are typically discharged within 2 to 5 days. They go home with 2 medications, a pain medication and a stool softener. They usually go back to normal activities in 4 weeks. There is a required follow-up care at 6 months, at 1 year, and at 2 years. They usually see the transplant nephrologist, and this nephrologist will usually do labs. All of this, including the surgery and most of the workup, is covered under the recipient's insurance. I hope this short presentation provides a basic understanding of the need of living kidney donation, and to help dispel some of the mystery behind donation. In the future, if you or your loved one is approached to be a living donor, you will have the principal knowledge needed to give the gift of life. Thank you.